Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about understanding the physiology of aging, exploring the natural changes in the human body as we age. Aging, a multifaceted process. Aging is a complex, progressive process impacting nearly all physiological systems. These changes lead to a decline in organ functional capacity and increased vulnerability to disease. Understanding these shifts is crucial for promoting healthy aging and effective medical management. Key areas of change: the cardiovascular system, the respiratory system, renal system, nervous system, and musculoskeletal system. The 1% decline per year after 30 concept. This statement reflects the observed trend of linear decline in the functional capacity of many organ systems once an individual reaches peak physiological maturity, which is often around the late 20s to early 30s. Reserve capacity. Heart failure symptoms, for example, shortness of breath with exertion, fatigue, and swelling in the legs, typically begin to appear when the heart's ejection fraction drops below 40%. Normal ejection fraction, which is the percentage of blood pumped out of the left ventricle with each heartbeat, is typically between 55 and 70%. For healthy individuals, a loss of about 20 to 30% of their peak lung function, achieved in their mid-20s, can occur without them noticing any significant symptoms during rest or mild activity. Approximately 75 to 80% of liver function must be lost before a person develops symptoms of liver failure, such as jaundice, ascites, which is fluid in the abdomen, or encephalopathy, confusion. Approximately 50% of kidney function must be lost before a significant increase in serum urea and creatinine levels is observed. Cardiovascular system: decreased cardiac output. The heart becomes less efficient at pumping blood, leading to a general decline in cardiac output. Increased blood pressure. Arteries stiffen, leading to higher systolic blood pressure. Reduced beta-adrenergic responsiveness. The heart's response to stress and certain medications, like beta agonists, is blunted. Conduction abnormalities. Fibrotic infiltration can cause arrhythmias. Respiratory system. The lungs in later life. Reduced lung function. Pulmonary compliance decreases and closing volume increases with age. The FEV1 decline. The forced expiratory volume in 1 second typically declines 8 to 10% per decade. Decreased in arterial oxygen. The partial pressure of arterial oxygen, PaO2, progressively lowers due to ventilation perfusion mismatch and anatomical shunting. Increased risk of complications. Elderly patients are more susceptible to conditions like COPD, pneumonia, and sleep apnea. The renal system, kidney function over time. Decreased renal blood flow and kidney mass. Both the blood supply to the kidneys and the overall size of the kidneys diminish with age. Stable serum creatinine, misleading. While serum creatinine levels may appear stable, this is often due to reduction in muscle tissue, which produces creatinine, masking a true decline in kidney function. Impaired fluid and electrolyte balance, reduced ability to handle sodium, concentrate urine, and dilute fluids predispose elderly patients to both dehydration and fluid overload. Increased risk of acute renal failure. The combination of reduced renal blood flow and nephron mass increases vulnerability to acute kidney injury, particularly after surgery. The aging nervous system, a decrease in nervous tissue mass, overall reduction in brain volume, particularly in the frontal lobes and hippocampus, loss of neuronal density in specific brain regions, accumulation of amyloid plaques and neurofibrillary tangles, more prominent in neurodegenerative diseases, but some presence is normal with aging. White matter changes, degradation of myelin leading to slower nerve conduction, increased white matter lesions impacting connectivity, sensory and motor nerves, reduced nerve conduction velocity in peripheral nerves, loss of sensory receptors impacting touch, taste, smell, vision, and hearing, musculoskeletal changes, sarcopenia, muscle loss, bone density loss, joint and cartilage degeneration, articular cartilage thins and degrades, reducing elasticity and lubrication. Ligaments and tendons become stiffer, less elastic, and more prone to injury. Connective tissue changes, collagen stiffness, elastin degrades, reducing overall tissue elasticity. Contributes to decreased flexibility, range of motion, and increased stiffness. Impact on mobility and falls. Sarcopenia and joint issues contribute to impaired balance and gait, slower, shorter steps, increased postural sway, and increased risk of falls and fractures. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you.